In this video, I'm going to demonstrate scrubbing in for surgery. I am working by myself, so I'm going to go ahead and open up my sterile towel and lay it aside there for me to dry my hands off once I get them all nice and scrubbed. And I'm going to open up our individual package of scrub with the scrub brush. And there's a little tool in there to get all the dirt underneath my fingernails as well. So I'm going to start by getting water on the scrub brush and getting my hands nice and soapy. Once it's nice and soapy, I try to get my hands nice and soapy so that the soap can kind of sit on my hands. And before I begin my scrub, I'm going to use the little tool and get all the dirt from underneath my fingernails. My fingernails are not very long, so there should not be a whole lot of dirt, but that is where there's a lot of bacteria harboring, and so we want to get those really clean. And at this point, I'm going to start my block scrub, and I'm going to start with my fingers on my right hand. I want to get it good and soapy, but I'm going to start with my fingers, like I said, on my right hand. And I start with my thumb, and I'll do all four sides of my thumb before moving on. And all four sides of my fingers. And I want to keep it good and soapy. And I'll just continue on for my right hand and just get all the sides of my fingers. And again, this is called the block method of scrubbing, where we do my right hand, the fingers on my right hand, or the thumb and the fingers on my right hand, the thumb and fingers on my left hand, the palm of my right hand, the palm of my left hand, and so on and so forth, up until I get within just a few inches below my elbow. And at this point, I've already started the scrub on my left hand, again doing all four sides of the fingers. I believe the first scrub of the day should continue on for approximately 5 minutes, and then subsequent scrubs after that can be a little bit shorter. But I believe that first scrub technically should be about 5 minutes. And now I've started on the back of my hand, paying really close attention to that area between my thumb and my finger. But I did the right side, then I moved to the left side. Then I'll do my right palm, and I'll move to the left. And you want to do at least 10 scrubs on each part. So now I'm doing my wrist area, and then the back of my wrist, and then the back of my wrist. Staying nice and sudsy. And then I'm working my way up my arm to 2 or 3 inches below my elbow is where we need to go. Right arm, left arm. And at this point, I've completed my block scrubbing, and we rinse from fingertips up the arm to the elbow. And you want to kind of, you see how my hand's kind of cupped there? We want to kind of cup it, scoop it up so that the water does not run back down to, say, like my fingertips. And then shake off as much excess water as you can. And I'm grabbing for my sterile towel at that point. And I'm going to let the water run and get someone else to just turn it off for me, because my hands are sterile, so I don't want to touch the faucet. I don't know if I could use maybe the sterile towel to turn it off, but at this point I'm just going to leave it on and get someone to turn it off for me. But I want to start drying at my fingertips and work my way down my arm. And I want to be sure that the hand that I'm using to dry with remains behind the